Yo guys, what up? It's Dr. Paul Thomas with Startup DPC, and I'm answering the DPC mailbag. So every week, just about every day, I get new questions, new emails from people who want to know more about direct primary care. And today, I have some great questions. There's about 5 of them. How much is a typical startup for a direct primary care practice? So how much does it cost to launch your own direct primary care practice? And before I answer this, I will say, I created a course on our website, Startup DPC, that tackles this. I take a huge deep dive into the startup cost for your direct primary care practice. And that's over at startupdpc.com/takeaction. And there's a business plan course. The business plan course, we really go into detail on this. But in short, you can do it for as little as $7,000. You can start a direct primary care practice for as little as $7,000, $10,000, sometimes $20,000. If you really wanted to be careful, you might want $50,000, but that's probably the maximum that you would ever need to start a direct primary care practice. And here's why. A lot of DPC doctors keep a really low overhead. For me, I started out by renting a space that was $600 a month. My next biggest expense was Malpractice Insurance, about $450 a month. My EMR was $300 a month. I was ordering about $500 a month in meds. I was doing about $500 a month in labs. And so in that first couple months, my overhead was like $3,000 a month. And then there were some capital expenses, those big purchases that I had to make in my first couple months. I had to buy an exam table, an EKG. So the exam table was $700. The EKG machine was $1,700. I got a pulmonary function test machine, or PFT machine, and that was $700, right? So, you're looking at, a few $1,000s to get it started, a few $1,000s a month to operate it, and you have yourself a direct primary care practice. So mine was on the low budget end, or the low cost side of things, but a lot of direct primary care doctors in this movement have the mindset of keeping the overhead low and understanding that by keeping a low overhead, they can have a flourishing direct primary care practice, because you don't need a lot to be successful in this model. You really need your brain and a stethoscope, and then every single piece of equipment that you add in is just another piece of value, so you can do a little cost benefit analysis on whether or not it's worth it to have that EKG machine or the PFT machine, etc. So that's my answer. Every DPC practice is different, so the startup costs are going to be different for every single one. I've seen it done for $5,000. I've seen it done for $50,000. It just really depends. Their second question was, I know malpractice differs in each state, but what is the average for the family practice in Michigan? Can this be offset by multiple doctors in a practice, or must it be individualized? So I mentioned this earlier, my malpractice insurance is $450 a month here at our practice at Plum Health. And then it's gotten lower as I've added in a second doctor, because now we have an umbrella policy that gives us both a little bit more coverage, and then it lowers the cost of both of our policies. So we're in Wayne County. It's a little bit more litigious in Wayne County. If you went to another county, it would probably be less expensive. Actually, I know it would be less expensive. When I bought the policy, our malpractice agent said that Detroit had the highest cost policy, or Wayne County had the highest cost policy. So at $450 a month, that's the highest cost. I talked to somebody in Texas who's a pediatrician, and their malpractice insurance policy was something ridiculous, like $70 a month. That's in one of our previous episodes, the Startup DPC show episode. So check that one out. Are you able to make a decent living? They say 500 patients, $69 a month, $70 a month. That's only $34,000 in revenue. And plus you're putting yourself on call with all that overhead, rent, utilities, taxes, staff, payroll, etc. Is it really worth it? And so, again, I talk about this in depth in my course, how to write a business plan to make sure you are getting the revenue you want to support the lifestyle you want. But I will say that nothing pays like autonomy. I didn't do this to earn a ton of money. I would like to make money in this. We are making money by practicing in the direct primary care model, but that's not the end all be all. And if you talk to a lot of DPC docs, we'd rather make a little bit less money and then be able to practice our full scope, to become the doctors we were meant to be, and to treat our patients with dignity and respect every day. that's really why we do this. The money's kind of secondary. But I will say that I have talked to doctors who make really good money doing this, and they have a little bit higher price point than what I have. I make a good living doing this, and I'm really happy with the way I'm able to practice medicine every day, and that's more important to me than the bottom line paycheck. The fourth question was, I can't figure out how this is different from Concierge, but I think it is. And holy rabbit hole, I'm not even going to go there. I'm just going to link one of my past blog posts because I really take a deep dive on this, the difference between Concierge and direct primary care. I wrote extensively about this for my blog, plumhealthdpc.com/blog. I'll link that blog post for you, so you can check that out. And then 5, what kind of small business package do you offer? Do you charge the business or each employee? So yes, we have many small businesses enrolled in our practice at Plum Health DPC, and we usually have everybody pay that $49 a month, that base membership, and then employees pay for the additional labs, meds, or imaging. So to be clear, the employer covers the employee costs. Each employee is $49 a month, and then the employees pick up any additional charges. All right, so there's your fast 5 questions. That's our Startup DPC mailbag. I'm happy to answer any questions that you have. If you really want to take a deep dive on this, though, take the DPC, Startup DPC courses. They're really rich with information. I take a deep dive on all these topics, especially in that business plan course, is where the answers to most of these questions are. So thanks so much for watching. Have a wonderful day, and good luck with your DPC practices.